All right, welcome to The Drive, first episode of 2025. We're going to talk about the SHARP method. I'm Dr. Whitfield, board-certified plastic surgeon in Austin, Texas, and I perform explant surgery. And so I'll lay out the problem. Breast implant illness is getting better and better understood. In 2024, papers were published to show the correlation between bacterial contamination and the production of a substance called oxylipin-10-home. This helps us better understand the symptoms because this substance is found in higher concentrations in patients with symptoms like brain fog and anxiety and muscle pain and joint pain. So there's now a cause and effect relationship. Now we know we can lower inflammation clinically by using our program. So the way the program works is, because there's not a specific test yet that you can do to determine you have breast implant illness, how I view it is everybody has a certain set of genes they inherit from their parents. So within those are our genes to help detoxify. And so when we're thinking about how we're going to detoxify, we're talking about how our liver is working, our kidneys, the gut, how it works. And so pathways for vitamin D, for methylation, everybody's heard of the MTHFR gene. Those genes, as well as ones for glutathione and for antioxidants. And then antioxidants, something like vitamin C is an antioxidant. So we concentrate on those particular types of supplements in the programming in my inflammation support bundle. So it's important to start lowering your inflammation now, not wait till surgery or wait till after surgery to try to do that. It's important to start doing that now. So from the jump, when I talk to someone, I want them to participate in both testing and supplementation, because the testing looks at your genetics, but it also looks at your toxicity burden. So SHARP is very effective at helping from a method standpoint identify opportunities for patients to heal by looking at toxins that they may have in their system. For instance, yesterday I spoke to a couple in Florida, and due to travel, the potential patient was exposed to different types of mold on a trip to Europe, most likely. Now, mold is kind of everywhere in older buildings with water leaks. It can be in foods, grains, coffee. There's a whole host of things, in wine, etc. So we want to make sure that we identify this and help the patient better understand what they're facing. So all those different aspects of mold can create, we'll just say, more inflammation. So we want to help someone curb that. There's multiple protocols. Some are holistic protocols. Some involve use of Sporanox. I've become someone who's using Sporanox more and more in my practice to identify and treat problems with mold. Not to identify, but to treat problems with mold. So that, and combined with, say someone has poor gut health. So we've converted the supplementation in my inflammation support bundle to predominantly liquid-based. So that's important. Liquids are easier to take, easier to swallow. We're going to get better absorption higher in the GI tract. So if someone has constipation, diarrhea, are having difficulty eating, having difficulty getting their calories in, we at least know that these supplements are going to make it to the target. So that's important. So getting the combination of testing done to really evaluate at a moment in time your metabolism and hormones and food sensitivities and gut microbiome health, like I said, in addition to the genetics and toxicity burden, are important. Continuing supplementation, throughout the first year, if not beyond, is important, because if you have limitations genetically, you can't go back and change your genes, but what you can do is really level up in terms of supplements what you're lacking and get your vitamin D, get your glutathione level, get your vitamin C level, get your methylated B complex. Methylation is very important for all sorts of reactions in the body, DNA repair, and so you need the methylated B vitamins, and you need to absorb them. So that's how, basically everything starts. And, those are big components, right? Testing and supplementation. Those are very big components to beginning to engage with us. And now for the first time, anybody in the U.S. Who is not having surgery with us can engage in our program. Our detox team works remotely. We'll help people through that process. And it's basically the same thing. We're going to do the testing, supplementation, and through the detox process, there's a couple different levers to pull. We typically obviously concentrate on sleep, diet as it pertains to food quality, fluid quality, and then we want everybody's air quality to improve. I support the use of really high quality air filters like Jasper and IQ Air. Those are the two main filters we use. So it's important to use that. It's important to drink filtered water and drink it out of stainless steel or glass, not plastic. But you can work with our detox team. So it's important to understand that for the first time ever, you don't have to have surgery with me to take advantage of our programming. And if you want to do that, go to drrobertwhitfield.com and fill out a contact form and say, hey, I want to use the Sharp method. You can go to the Dr. Rob Solution store and purchase an inflammation support bundle and start using that. That will help lower your inflammation now. You can read my book. I wrote about Sharp. It's entitled Sharp. It's available on all the platforms. And I listen to books all the time. So it's available on iBooks and Spotify. It's also on Amazon, of course. So there's all these assets as well as a set of video modules that have been produced to help patients in the process of Sharp. So it's all coming together in 2025 to help lower your inflammation now. So if you have breast implants, someone with breast implants, you need help lowering inflammation, send them this YouTube video. It may help them. You can listen to my podcasts about explants. We look forward to hearing from you.